Beach, California. I'm going to wait for some more people to come on, but I'm going to talk a little bit about MicroLipo tonight. And then also, of course, anything related to acne, to scars, pigmentation, the things I really specialize in. So for those who don't know me, I specialize in just a few subjects, really a few things. I really try to get really focused on scars, on pigmentation. I do a lot also with skin tightening. And I also do a lot of collagen fillers. So if you have any questions about those type of things, let's talk about it tonight. And I'll be happy to kind of go through just my overall process and my philosophy for patients. I really want to make sure that people do look their best, but also I want to make sure that people look really untouched, really natural. I really want to avoid the alienized look that sometimes is really prevalent out there. And so one of the things that I get requests a lot is with chiseling out the jawline and getting some sharper angles of the face. So that's what I want to talk a little bit about with you guys tonight, because here's a patient. She's a cancer patient, and she really had a stubborn pocket of fat though. I want to just look her best. Even if she lost weight, there was still that pocket of fat. So this was something that was really bothering her. This is something that a lot of people said would just lose weight. But if you look at it, actually, some people just genetically just have loose skin there, and they also have volume, a little bit of fat that's there. And so for this patient, what we needed to do was not only remove the fat, but we also had to contract the tissue, tighten the tissue. So that's what we ended up doing with MicroLipo and something called FaceTite. I really like FaceTite because we could actually tighten the skin, we could contract the tissue, we could do it in multiple different layers, and really try to get it as carved out as possible for people. For this patient, it's a really nice improvement for her because also she's somebody who didn't want to go through surgery. She had gone through with cancer. She didn't want to do more treatments like that, nothing really aggressive. And so here we were able to do this minimally invasive, just go inside. There was with a small little probe. It really is like, think of it really, I don't have a pen tip right now, but if you have a pen tip, just the tip of a pen is really the size of the hole that we're going in there. So it's really, really nice for people who don't want really invasive procedures. So that's what we ended up doing for this patient. This is MicroLipo with FaceTite. Really, really something I love to do, because a lot of people will say, well, first of all, you should only do surgery, which sure, if that's necessary, then I think that's and if somebody's willing to do it, then it is a great result you could get. But for someone like this who doesn't want surgery, wants a fast downtime, really it's just about a weekend of downtime, a weekend of recovery, you could get a really, really nice result then. Now, you are still going to have some swelling. You are still going to have a little bit of asymmetry for a few weeks afterwards, but it's really not too noticeable to most people now, especially if you're really good about wearing compression. So if you wrap it up, keep it tight, that'll help actually with that swelling and reduce that. So really, it's a nice procedure because we also are doing something without putting too much filler in there. There's a lot of patients I see, because I dissolve so much filler. I go through so much of dissolving. I have an ultrasound. You guys see me. A lot of people come to me for ultrasound, really across the country, especially the state also. People come to me, they want me to do ultrasound of dissolving a filler. And I see so many cases of people who have filler in the jawline, in the chin, and someone like this patient would have potentially been somebody that they could have done it on. And if you look at it, it looks really nice from the side profile, but it doesn't look as great three-dimensionally. A lot of times that jawline filler isn't that great, especially if you're trying to do it just to hide fat. It's not great if you're trying to hide fat. It's a lot of times going to make you more like boxed out. It's going to make you like that squared off look, so it doesn't look that great. This patient, though, she would benefit, though, I would tell you, though, she would benefit from a little bit of chin filler now. And then now at this point, if we did it from along her jawline, I think that'll be really, really nice. But in the beginning, I don't think it's really valuable for her. Really, the best thing to do is to really chisel it out as best as you can. And you could do that with MicroLipo and then also with buccal fat removal. This is a patient that benefits from buccal fat removal because there is this heaviness over there in the lower part of her face. There is that fullness there. So if we took out that buccal fat, and my partner, she does a great job with that. She just does a single poke, really gets that deep portion of the fat, and then removes that pocket that's weighing things down. And then what I do is I go in there and I tighten the whole area, tighten the skin, and then the tissue contracts really nicely. So that's really nice, really something that I would recommend for people when they're struggling, especially with genetic fat over here in the submental area below, or even just loose skin over there. If there's some loose skin, sometimes what you may have to do is go tighten. Christy's asking, what did she get done? This is MicroLipo with FaceTite and buccal fat removal. So we did all those things to really tighten the skin. This is a relatively early result. There actually still will be continuous, the skin quality will continue to get better over time. This was just about the 3-month mark, I believe. But really it will continue to get better over time. And in fact, actually, I've seen this patient more recently. She still looks really great. And to be honest with you, just doing this actually looks as if somebody has taken 20 pounds off your face. Although it wasn't really, it was just a little bit. Really, it's not that much fat that we take out. We're talking like, sometimes 20 to 50 cc's max. So really tiny amount of fat that we take out. But that fat, it could be a little abnormal because it's like sometimes if you have in a small little area a little bit of fat, like on your hand, for example, that'll be really odd. So that's the same type of thing with gravity, especially it's pulling things down. So it may become a problem for some patients there. What are my thoughts on Rejuron and all those injections that Koreans get for perfect skin? Well, I think there's a lot involved with getting perfect skin. I think some of it is with ethnicity, a lot of it is with genetics as well, and then some people just have the propensity to scar. Some people have the propensity to have more oily skin and then more acne. So all those things we should kind of pay attention to, because I have a lot of Korean patients, and I'll tell you honestly, there's a lot of pressure to have perfect skin, and many of them coming to me because they're trying to achieve that. But it may not be possible to get perfect skin, especially if you have skin conditions like melasma, for example, or if you have severe acne scars, things like that. And there's a lot of societal pressure, not just within the Korean community, but other people then expect Koreans to have perfect skin. But just like any human, there could be issues. Sometimes it could just be a woman on her period, and she ends up having a breakout at that time, and now suddenly it's not perfect. So I don't think that that's something that we should probably emphasize a lot, that they have perfect skin, because I see a lot from the other side that a lot of Koreans do have a lot of pressure to get perfect skin. I think it'll be really nice if we kind of eliminate that huge pressure. Instead, though, focusing on just to get the best possible results, I think, Rejuron, we don't have it available in this country right now, but it certainly sounds like a good idea just to kind of slowly plump up the skin without giving that overly puffy look. That's really nice. It integrates really nice with the tissue. But there's other options too. For myself, I do a lot with collagen stimulating products. I do Bellafill, I do Sculptra, I do Radiesse. I think those work really, really well. So that's what I typically recommend. So just so you know, it's kind of complex. It's not just about doing something like a little filler here and there for your skin, and that's going to give you the solution. Sometimes it's about some people do have genetically, they just don't scar, they don't get pigment, and that's awesome. And of course, wearing strong sunblock, things like that. Those are all things that are all really, really important. So I know I missed a few questions here. So thoughts on mouth taping for sleep? Actually, I do that. It works really well. I love it. Actually, I think that more people should do it, especially if you notice that your mouth is more dry in the morning. Things like that. That's all something that you should pay attention to. Sometimes, though, really the reason why you're breathing through your mouth, like for myself, is because sometimes I get a little bit of rhinitis. My nose gets a little bit stuffy due to allergies, especially during certain seasons. So it's like I have to be on top of it for allergy medication, nasal spray, those things, and that's going to really help out. But yeah, mouth tape is great. Actually, I think it does really. There's a lot of effect, not just like for oral hygiene, things like that, but also structurally, it actually helps out with your jaw. There's a lot of studies that showcase over and over that mouth breathing is actually really terrible for the development of your jaw. So your chin, your jaw. So breathing through your nose is really valuable for people. Let's see. Your Canadian girl saying she looks like the woman on the left's daughter took years off. Awesome. Yeah, that's what I think too. Really took years off. And there was a study a while ago that basically said that people with a little bit of some mental fat, other people assumed that they're 20 pounds heavier than they really are. So interestingly enough, I think that that's actually true. I do think that is something that a lot of people would say is true. That people, if you looked at the patient on the left, even if her weight was the same, at this point, it looks as if the after photo is as if she's more than 20 pounds lighter. That's a big difference, really, just from this. That's what it is. Let's see. Christy's asking, am I the one that does neck lift buccal fat personally? I want to see if you're the pro. No, my partner does it. My partner does it all the time. So you could look at her work. Dr. Calaria, she's on our page. She's excellent, really. She just does a small little poke just to pull out that buccal fat. And she also does neck lifts, really, really nice. When I've talked about it before, but I used to think that I was going to have to do a lot with like scars for surgical results, things like that. I thought that I would have to help a lot with that, but almost never do I have to work on or worry about her scars. Really, they're super, really, really perfect, beautiful work actually. So and it results really, really well. Period is saying I did a cure laser, but BBL laser wasn't done. It's not always done. It's more if you have like active lesions, then it's done, and a lot of active lesions, and typically there's a extra cost to that. But we could talk to my office though tomorrow, see if you were supposed to have the BBL and that wasn't done. Let's see what happened there. Cheers, Agisha saying their plastic surgeon has a special technique, so it's only one stitch. Awesome, yeah. So it is really only one stitch actually. So I've seen it done in the OR before, where people. Older plastic surgeons, for example, they really make this huge gash in the mouth and take out like a whole bunch of fat too sometimes. And so sometimes they end up taking like superficial fat outside of your in your skin. And it could be a disaster really for some people, because you're, maybe right now it looks okay, but 10 years, 15 years down the line, it could look really hollowed out. So instead, just taking out only that deep pocket of fat is really, really nice for people. We still preserve your superficial fat, so as you get older and older, you actually are still aging gracefully. Because actually that deep pocket of fat could actually weigh down your skin with gravity, and then you end up needing like a facelift and a neck lift, because that buccal fat is displaced. So it's really, again, something that people should pay attention to. You'll see a lot of people would say, well, what you really need to do is do jawline filler and do cheek filler. And it's totally inaccurate, really. The filler is not going to lift the buccal fat. And then the other thing that people would try to push and say is, why not just do threads? Well, threads are not going to hold buccal fat. Believe me, actually, at one point, I was doing some of the most threads actually anywhere in the area. I was doing so many threads every single day. And I was looking at it, like my patients were happy, I would say. But I would find that just sometimes, especially in the buccal fat area, wasn't lasting as much as I would have liked. And then I saw, because I do so much with subcision and things like that, so I had to deal with a lot of complications in the area. And so I was breaking up a lot of people's threads and stuff like that. And I saw that it was really not worth it for people, because it's a temporary effect, and then it could cause indentations. It could cause, really actually more fibrotic tissue inside the skin as well. And so I was like, I'm not going to really be doing it as much for the vast majority of patients. So just so you know, really, I moved away a lot from my practice from doing threads. Actually, it was something that I used to love doing. I really liked the results. And then I was looking at it that like it's really just for the reason why they still get complications with it that are not reversible. A lot of times you have to go to someone like me who does a lot of subcision to reverse it, and it's still really complex. I'm doing subcision in an area just to get rid of that thread that's stuck on the skin, and there's more trauma involved for a patient that's unnecessary, and I have to do it that way. I have to dislodge that thread. So that's why I'm not a fan of really PDO threads as much, especially for things like this. There's weight that's pulling down the skin, not the best option really for this. So instead, doing this type of procedure, doing localized small little liposuction, just removing some of the fat, tightening the skin, getting really great tissue contraction, doing something like buccal fat removal for the heaviness in the lower part of the face. That's something that's going to work out really well for patients, and that's something that you're going to really be able to see over and over and over some beautiful results. And I love that. I think that that's something that probably needs to be pushed a lot more than it really is. Instead of just people just pushing and shoving fillers in it, we now know, everybody knows, or at least that's what people are talking about. I was looking at my TikTok feed was just full of it, of people talking about Kylie Jenner and about like that she may have gone a facelift, things like that. I'm not going to speculate and see if she did or not, but there was certainly an aspect where it did look like she had filler. And there's other people who've admitted that they've done filler, such as, Courtney Cox, and it really was really overblown for her. It really was not a very natural look for her. And she looks much better with it dissolved. Now, if someone like her had ended up doing something like a facelift, neck lift, or something like FaceTite, which would have tightened the skin, that would have been really nice. And then I would have preferred, especially for someone like Courtney Cox, to be doing like more like collagen stimulation. That would have been really nice. So I think that would have been really, really great if we did more collagen and really worked on tightening the skin, improving the skin quality. That would have been really nice. And otherwise, if you're doing just filler, it could really get really blown up. Honestly, I mean, who hasn't walked around, our areas like in Beverly Hills and like and if you walk around, a Fashion Island, you walk around there, it's like this epidemic of people that I think we have to just take a look at it and see that really, we should not have this alienized look anymore. It's like this thing just has to go away. We have to really understand that this is not like going to age well for people. In fact, I dissolve so much filler and people look at it and say that my face is deflated afterwards. Well, really, it's not my fault because I dissolved stuff that was displaced and I looked in the ultrasound as displaced, but it really is like, talk to your injectors, talk to the person that injected that stuff. They injected so much stuff in you and they didn't tell you that this stuff lasts for years and years. And they didn't tell you that it can stretch out your face. And they didn't tell you that they do it with a cannula and they put it too superficial a lot of times. And that's really unfortunate. I'm sorry that happened. Stretch out your skin in your 20s. That's really unfortunate. I've had patients who are really, in their 20s and their early 30s who had so much filler in their lips, so much. We're talking like 8-10 vials sometimes. And it totally displaced, the filler is pushed up, the skin is stretched out, and they're insisting on trying to do more filler or something like that. So it's like, instead, actually, honestly, really, when you're doing filler, either wait a while or dissolve it every time. Really, you just do a little bit of dissolving and get rid of some of that's on top there. And so when you do it again, it's going to look really good. People don't really want to wait though. They're so worried it's going to look deflated. Honestly, a lot of times it looks better deflated. Honestly, when it's overfilled like that, it could just look so unnatural. So that's what I'm trying to avoid for some patients. Like if like what I was talking about with this, I've tried a lot of times to avoid that overfilled look. So that's why I do like things like MicroLipo, FaceTite, collagen stimulation products, all those things to help out with it. Diana's saying, how do you feel about doing red light therapy on your body every night? Can that help collagen? I think it could help potentially, but I'm not so sure, honestly, that a lot of times the people that push it, they end up selling it or they know someone's selling it. So it's a little bit kind of funny to me for that purpose. So I can't really say, honestly, I think that there's a lot of other ways of just helping with collagen production, especially just avoiding sun exposure. That's one of the biggest things, like the first starting with that. And then we could kind of talk about doing other things like maybe like introducing like a light retinol or retinoid in your regimen too. Franny's saying, what do you think about cold plasma devices for brown and darker skin types? What are you trying to treat, Franny? I think that's where it matters, actually. Suki saying, I'm from Canada. I need scar treatment. Would you be able to do extensive scar treatments in one weekend, or would it be multiple treatments? Yeah, I specialize in really doing a bigger combination session, doing multiple different layers of the skin, really breaking up the scar tissue, stimulating collagen production, using laser, really doing it all under a single session. So I have a lot of patients from out of state. A lot of patients actually from Canada as well. I'm not sure where you're in Canada. The other patient that I just had a consult with the other day, he was from Toronto. I've had a lot of people from Vancouver, a lot of people from Toronto, and Ottawa also. So even in Montreal actually recently. So a lot of Canadians. Actually, by the way, I love Quebec City. No patients there from Quebec City yet. Diana is saying, how do you feel about, I think I answered that, red light therapy here. Let's see here. Slyn Mika is saying, I'm Mexican and I get scared to do anything that will cause hyperpigmentation. Yeah, I agree with you. I mean, most of our patients are Hispanic, just most of our patients. I'll tell you, really, when starting here, I'll explain the whole process actually. When I came from Chicago, came over here, and it was really obvious to me that, the Hispanic community over here, there wasn't really anybody that was doing things at a very, very high level with lasers and for like pigmentation, for scars. And I really wanted to help out the community because it's like, it was sort of just like left alone for some reason. And I looked at it and it's like, and when you actually see it, there's a lot of skin conditions that, sometimes there wasn't access to people that could help out with it. Or other times, to be totally frank, some people were just doing reckless things on Hispanic skin. It was dangerous stuff. It seemed like they were sort of experimenting on them or something like this. It was like, sometimes it was really terrible. I was seeing these like burns, and I was seeing people that were using inappropriate devices there. It was just inappropriate techniques. And so I wanted to just make sure I was doing this really, really well. And I was like, this is like the thing that I'll be known for. And really, it's interesting. Like a lot of times, Hispanic patients I've noticed will say who their injector was, who will say what they did surgically. We'll tell everybody that. And so word of mouth really spread that here's a person that's doing things really well for us. And so just so you know, a lot of patients in the Hispanic community, and I love treating it because it's like something that really needs to be done at a very high level for everybody. And I think it was really neglected for a while in this area, especially in Orange County. It's like a lot of stuff was just kind of, I thought, reckless. It's like, would you really do the settings with the laser on a darker skinned patient like this? Or like, was that really something that you thought was a good idea? And Morpheus 8, you're doing that on these patients. It's like with high energy on high heat. I told you guys before, I had a doctor tell me that she always goes and does all these settings on the max because she just thinks there's no problem that's going to happen with it, and otherwise it's not going to work. And she's doing that even on Asian skin tone and even on Hispanic skin tone. And it's really risky. That's really, really risky. So it's like you could really run into a lot of burns. I've seen these burns. So it's like, be like really mindful of that. Be like careful about where you're going. We want to be really careful with your skin. Even when we're doing things like MicroLipo, FaceTite. Actually, I've noticed that Hispanic patients could benefit more from doing something like buccal fat removal compared to other ethnicities. There is a buccal fat a lot of times that could be removed if you're worried about your double chin. But some other ethnicities, it may not be something that's as pressing. So just little things like that we pay attention to, and we could adjust and make sure that we could get the best possible result for everybody. Got to be mindful and demure with lasers. Yeah, I said be mindful, and I was thinking in the back of my head about that, but I was like, I needed a good tagline. Thanks for getting that there. That lady, by the way, I love that video. I talked about it before, but she's such a positive person, actually. When you actually look at the video, like the original video, it's like just like a very positive person, actually. It was like kind of really interesting to see that. Like she really, you could tell, like was meaning it in a really sincere way. At least that's what my impression was. Maybe you guys felt differently. But to me, I looked at it, I was like, she's like very sincere when she was saying this. Like I felt like she was like really trying to like help people out with like how to do things at work and like just like when you were at your interview and be the same kind of person and dress the same kind of thing, I thought it was kind of interesting. I thought it was like she really was trying to like do it from like a good place. And I appreciated that. Sometimes it is like the message was fine too. It's like, but sometimes it really is like the sincerity of somebody comes across on these things. That is why I like a lot of the stuff like social media and like just talking to you guys in general too. It's like it's kind of fun because there is like more of like the less of the formality, which I don't love. I don't love formalities, honestly. I do actually want things to be like just more of like equalized, in this world. I do think that there are some people that are experts. I do understand that. And I do think that we should understand there's a lot of things I'm not an expert in, a lot of stuff. One of my patients, she's an astrophysicist. And when I ask her, questions that my son may ask and things like that, and I'm like asking her to explain it to him. And she does break it down to like a 5-year-old, and I think my son will understand it. But I sometimes don't really understand all the astrophysics of that, like dark energy, dark matter, and it's like what the difference is and things like that. So there's a lot of subjects that I'm not an expert in, and that's okay. And it's like it's fun to like kind of just like know that like we have experts out there, and we could learn from these things, and we could look and point to the different areas. But that being said, it doesn't mean that like we should view ourselves as actually in like a different class from our patients or anything like that, or the other people. That's where the real problem is, because everybody could be an expert in any little thing that they're doing, and that's really fun. It's like, it's great. Actually, I think I think like that's like my favorite kind of dinner conversation, actually, when like I ask someone what they're doing and like they're really excited about what they do. I love that, honestly. That's like my thing. And it's kind of like, why I always kind of like try to figure out what people are doing, because I love what I'm doing. I'm not like trying to like judge what someone's doing. I'm just like thinking, okay, that's really cool. Like you like are excited about it. And if you're not excited about it, a lot of patients will know. I ask though, like, what does excite you? What would excite you in the future? If you like picked your dream job, what would it be? What would it involve? And a lot of times it's like really interesting. It's like people will say something like art. A lot of times they'll say like, or like just like starting their own practice or doing their own business type of thing. Doing something that's totally different. My patient on Monday, he's talking about how, right now he's doing business and he's working with like, a consulting firm. And his dream job though is just like, he thinks he'll be like an amazing killer physical therapist. Personal trainer. He thinks he'll be like an amazing personal trainer. It's like awesome. It's like kind of interesting, right? Like it's just like that, that would be like his actual fun thing. And maybe that's what people think, it's like, it'll be fun. Like I think that like maybe it gets someone thinking that maybe I should do that instead of doing consulting, because like, yeah, why not? Why not just be happy and like enjoy ourselves? Foreign Crick saying, I like interior designs or any jewelry design, but not feasible. Honestly, what's interesting is that, there's some countries that are giving stipends. Ireland's giving a stipend. Spain is giving a stipend also for artists, interesting enough. Christy's asking if I can answer the question. Sorry, Christy. Let's see what your question is. Okay, here it is. What's the difference between neck lift and buccal fat removal if you just have a heavy lower face and cheeks? Well, so the buccal fat removal is really for the full area, and actually you can combine that with a facelift, neck lift, but it's really where there's that fullness in the lower part of your face, like it's really more of fat underneath there. So that's really where buccal fat removal is going to be really, really nice for you, just to pull out that deep pocket of fat. And you can combine that with facelift and neck lift, and really when you're pulling on your skin, you'll see how does it snap back. There's like a pinch test that we do. We pull it out and see how long does it take to snap back. So see how long it takes to do that, and then you may have to remove skin. If it snaps back pretty well, but you still have some loose skin, then you actually are probably a candidate, like someone like this, with something like FaceTite. That's probably a great idea. Cannoli saying skin therapy. Love your saying love your attitude. Appreciate you too, Cannoli. Thanks for coming on. Mel is saying, does Bellofill help acne scars or only volume loss from acne? Well, it helps with acne scars directly. You put it directly underneath the scars. It's going to stay there and support the scar tissue. It's awesome. It's always going to provide a scaffold over there. So I like that. I like the fact that 20% of it's there and it's going to continue to stay there, which is really, really useful for people, because even if they have some volume loss later on, you always have some support there for your scar. But you could also do like Radius, Sculptra. Those are all options there. So consider doing that. Foreign Cooks, what do you do, by the way? Foreign Cooks is saying that they want to do interior design or jewelry design, but it's not feasible. I'm kind of curious, what is your job right now? Just out of curiosity, like why are you not able to do that? The person's also saying tretinoin 0.05, would it help with deeper scars and hyperpigmentation? Probably not so much, to be honest with you. Probably not too much. Deeper scars really do require like manual work, TCA cross, laser, those things. How do I choose between Bellofill and Radiesse? I use Bellofill really more for like discrete, smaller scars. Radiesse for like a wider area, especially if there's more like skin elasticity problems, like it's looser. So we want to tighten the skin. That's when we'll consider Radiesse. Give you more volume, like the most volume, probably Sculptra. But so it just really all depends. Foreign saying graduate in civil engineering, but would like to be remote, getting into data science. Oh, I see. Okay. Well, that's a different world. I mean, if you want to do interior design, it sounds like you're probably should maybe combine your new skills of data science with something in that industry if it's possible. If not, maybe go into that. Maybe go into interior designing is an awesome field, honestly. It's a really good field. It's super fun. Like I would love to just go walk around different offices and be like, yeah, I'm not really feeling this thing. We spent a long time. We still not even done. Like there's so much work to be done with interior design, honestly. It's just that you start getting into it and it's like, you want to fix this thing and you fix this thing and you fix this. And so we kind of like, I had like these stop points there because otherwise we had to keep on shutting down the office for like a day or two just to like get that stuff fixed. So I was like, I just want to get this thing done and like we'll move on. But there's still like more things I want to do. There's like a lot of things actually that'll be cool. I love interior design. I would love just to walk around and like just like let's change a lot of stuff right now. A lot. But sometimes it's just like time consuming. It's not that people don't have style. It's just that it's really time consuming and like of course also it's expensive for people. But it'll be it's nice. Or architecture. Honestly, I think personally. I don't know how long it's going to be true for, but I really don't think interior design and architecture are going to be phased out by AI. Miriam, I'm on Instagram lately. Actually, for the last week, I decided to do that. Actually, I'm streaming. I'm using a different thing now to stream on multiple different platforms. So the other things have kind of taken a dive down while we shifted actually. Like the viewers kind of went down a little bit here just to see they're kind of learning the new format that we're doing now. So I'm on here, by the way. Everyone is still on right now. I know a bunch of new people joined on too. But I'm on 9 p.m. Pacific time, Monday through Thursday. And feel free to ask questions, about the things I focus on. I'll showcase some more things next week. Some people were asking more about MicroLipo today, so that's why I decided to put this up here. I do see a lot of your questions, by the way, just because I can't get to all the answers. I do see a lot of them. Like during the day, I try to go through some of those ones, but it's really tough to kind of give answers. So I just try to do it at this time then. So I just try to answer a bunch of questions. And then I like the fact that it's just like, people that are on here get to enjoy that and get to see and like hopefully learn something out of that. The girl who loves teeth says there's small boxcar scars, though not very deep. I just have many. Well, then you may try tretinoin. You may try that. All right, guys, I think I know I missed a bunch of questions, but I'm going to hit these more on Monday, though. And thank you so much, Canoli. I don't know if I said your name exactly right.